This original WSRE presentation is made possible by viewers like you. Thank you.
Aging is a given. Getting old? Well, that may be an option. Dr. Tom Schneider tells us how to stay physically young on this edition of Conversations. The mythical fountain of youth. We're all looking for it, and while we certainly cannot stop time, we can perhaps improve the journey. Dr. Tom Schneider is the medical director of the Florida Healthspan Institute, where the focus is to do just that. He calls it anti-olding. Dr. Schneider believes medicine, science, and lifestyle can greatly alter the pace at which we physically and mentally age. Dr. Schneider's impressive credentials include board certifications in 4 medical specialties and training at elite medical facilities like John Hopkins, Bethesda Naval Hospital, Harvard, and the National Institute for Health. We welcome to our program Dr. Tom Schneider. Thanks for being with us.
Oh, Jeff, this is a treat for me.
Tell me why you decided to focus your practice on aging.
Well, I would love to be able to tell you that that's what it's about, but it's really about living. And I don't mean that as a quip. It's really about how to live. Because the bad news is, and I'd really like it to just stay here in the studio.
Okay.
We're going to die.
Yeah, you think, huh?
Yeah. So that's been shown in a number of studies, and none of us, although physicians like to think they're MDs, minor deities, we don't have control over that. So it really comes down to what can we do to make life better? Now you hear words like wellness all the time.
Right.
What is wellness? I mean, I've been practicing it for 15 years and I don't know. Now, I have a relative who's 94. She broke her hip. And I called her and asked her how she was doing. Sister, how are you doing? And she said, better than yesterday. And I think that's the best definition I've heard of wellness. I want my patients in the world to be better tomorrow than they are today. And it can be in any parameter. Oh, I didn't compliment my wife. I'm going to do it tomorrow and do it. I'm going to walk 250 more steps. I'm going to make a diet plan for myself. Whatever it is, better tomorrow.
What are the biggest mistakes we make from a health standpoint?
Well, I think the biggest is, of course, the economy today has made medicine turn into a mill. Now, I'm a doctor, as they say in Brooklyn, I is one, so I can say this. We've done a terrible job of becoming economists and not physicians. So the word doctor, I ask doctors all the time, what does it mean? You are one, and they don't know. It comes from the Latin docere, and it means to teach. Well, we don't have time to teach anymore. We have patients, insurance, more forms. Teaching is lost. The patient is the one who suffers. So at Healthspan, nobody comes to me for 10 minutes. Nobody has a 15-minute appointment. The appointments are 2 hours, 4 hours. Some people come for the day. I sometimes feel we're married at the end of the day, but it becomes a very intimate situation where my goal is to teach, not to prescribe.
What would a typical appointment be like?
Well, a patient would come in prior to even coming in. They will fill out an extensive, what we call HRA, and that tells me their lifestyle parameters right now. Do you smoke? Do you not smoke? Do you take pills? What pills? How much exercise do you do? They do an extensive dietary profile for 3 days. They mark down everything that they've eaten, and we look at that. We say, you know, was the Haagen-Dazs such a good choice each day? I'm all for it one day. You know, there's no such thing as a bad food. There really isn't. Well, wait a minute, donuts. No, they're fine. They're just not fine every day or maybe even every week. So our focus is to teach. And here's the key, I think, Jeff. It's to teach the truth. Now, I know that sounds like a Hallmark card, but bear with me for a second. Right now, there is so much on television, infomercials, you know, Oprah, Oz. I love them. They're putting the word out to be healthy. But what is being told and taught to the public is just scientifically not very valid. So where's the truth? That's what we try to do and teach. Now let me ask you this. If I said to you, Jeff, I want to teach you the health, truth, and the best of it for you, I would hope your first thought would be, why would I believe you? And I did buy the ThighMaster years ago. It didn't quite work. But my point is, why would you believe me?
Why would I?
Yeah, so one of the talks that I give might be with 100 patients or 100 people in a room. So imagine you're the 100 people. And what I say to them is, why would you believe me? I want to first know what your level of wellness is. So raise your hand if you've weighed 100 pounds or more. Thank you, ma'am. Thank you, sir. You weighed 100 pounds or more. That's great. Raise your hand if you have diabetes. Insulin diabetes. Have you lost your kidneys to diabetes? Wow. Hypertension, cholesterol. We hear a lot about that. How about something like cancer? Wow. Anybody spent 4 months or more in an ICU? Oh, wow. Good for you. How about hearts? That scares people. Heart attack? Bypass? What are those little things they put in there? Yeah, I didn't know that.
Yeah.
Thanks. Stents. So let's count them. 1, 2, 3, 4, 5 or more stents. Raise your hand. Somebody out there. Now, this is getting boring, so I'll stop. It could go on, but we won't. Here's my question to you, the audience. Raise your hand right now if you're alive and you've had all of those things. Somebody, and in every talk, one person has their hand up.
Is that you?
And that's me. Because that was my lifestyle history. So that's in going back to your original question. Why did you choose aging? No, I choose living. And back in 1994, when all of that happened, I was a disaster and part of the medical system with pills and pills and pills and fatigue and impotence and depression and lassitude. And fortunately, I found a number of physicians who were just developing this concept of what can we do ourselves, and is there science that can help? And the answer is yes. So very fortunately, for example, I'm 66 now. I work out, have a little daughter that we adopted from China. I could tell you the rest of the story, but it's all good. Well, as of 1994, those disasters happened to me. I fortunately broke out of it, found some doctors who said, you know what, Tom, we're working on utilizing hormone therapy, like a little thyroid, like a little testosterone, because your levels are terrible. Really, because I had my blood tested by my doctor. No, not that testing. The real scientific testing of what your thyroid is, or what your testosterone is, or what your adrenals are doing. And lo and behold, all of these abnormalities occurred. And I went on that regimen and became part of the teaching and part of the research. And hence, what is it now, 17 years later, I'm alive. Now, how many would be alive 17 years later after that? I can tell you the answer is 0.
Yeah.
How many people lose 100 pounds and can keep it off? Now, that's not a credit to me.
Right.
It's a credit to what is available from a science standpoint. And if you said to me, what's one of the major problems for the patients that I see? It's head. Really, what's that mean? It means getting your head together, waking up like I do with Ellie, my little adopted daughter, bouncing on my chest. Fortunately, it's relatively healed. and loving every single breath. Now, how do you get that? Well, that's what we try to infuse into patients. So that's number one, is getting the head straight. And then a host of other medical problems that, unfortunately, in today's medical society, and I'm not putting it down, I'm part of it, but there isn't enough time. There isn't a way to educate. And there's a lot of, to put it in the most kind terms, a lot of economic reasons for using medications and various items that are frankly ineffective.
Well, just look at the amount of money that's spent on television ads promoting various pharmaceuticals.
Yeah, exactly.
I often wonder, are that many people in need of those?
No, and I'm going to give you one quick scenario of a gentleman who would come into me. I'll give you this as an example. Comes in, and, or to his family doctor or whomever, blood pressure's up. Here's a pill for you. So he's given a diuretic that's standard across the country. Here, he takes it, comes back. 6 weeks later, his blood pressure's down.
Right.
We're minor deities. No, we're not. We simply lowered numbers. The why that hypertension is happening with him, we haven't even looked at.
Right.
That's what we try to do in Healthspan. Why do you have hypertension? Now, let's take that fella, and when he comes back, I have the time to say to him, you feeling better? We saved your life. We've got your numbers down. Right. You feeling okay with all this? Well, doc, to tell you the truth, and I'll let your television take over on this, I've got a little problem. Really? Yeah, I'm impotent. Well, we've got a pill for that. So he gets a blue pill to fix that. Now he's on 2 medications. We haven't touched lifestyle or why on any of those. But now he's on 2 pills. Let's bring him back 6 weeks later and draw his blood. His sugar's high.
Right.
Good gracious, you're diabetic. Well, we've got another pill for that. Why? Why is he impotent? The hypertensive medicine made him impotent. Really? What about his diabetes? Same thing, the concoctions of medicines increased his sugar to diabetes. So if you take that scenario, carry it out in the United States, and take the average 75-year-old going into a nursing home, how many pharmaceutical pills do they carry in that brown bag?
A bunch.
13. And if you're in the VA system, it's 17. That's enormous, with interactions of drugs and side effects. And it sounds like I'm poo-pooing the No, I take pharmaceuticals, but I take absolutely what's minimally indicated and what we have the science for.
But it's almost saying, too, that it is incumbent upon the patient to take responsibility for themselves.
Where did you go to medical school? Because I'm telling you, I speak to physicians all year long, and that's exactly the point of this. Patients today cannot simply say, I'm putting myself in the hands of my physician or healthcare. Tom, how can you say that? That's so disparaging. No, it's not a condemnation of the system. It's you've got to do your research. And fortunately, you have tons of ways to do it. The information is depressing to patients. So if you watch Oprah, God love her, I love her, she's great, or any of her physicians or any of the physicians, or if you go to one, my problem is I'm overweight, doctor. The answer is unquestionably, you need to diet and exercise. And here's the truth. Research this. That's what I do. It's a lie. It's a lie. What does a diet mean? You're going to live on carrots and celery or the cabbage soup diet? It's crazy.
Right, right.
And you lose weight and then it comes right back up. Why is it not effective? Because we haven't looked at why you're having the weight problem. Oh my gosh, a very sophisticated thyroid test shows that you have an abnormality in your thyroid. It's a sophisticated test. It's not normally done, but I see it all the time, all the time. Your testosterone is in the toilet. Oh my goodness. So it's a symphony that you have to put together if you're going to work on the problem. But who would deny exercise? You wouldn't.
No.
It's great. Don't get me wrong, it is fine. But if you think you're going to lose weight by exercise, I'm going to give you a quick statistic. For you to lose 1 pound, you and I can do that Saturday, 3,500 calories. We're going to use your treadmill. We're going to run at 6.5. That's this fast. How long do we have to run on your treadmill at that speed, 6.5, to lose 3,500 calories?
A couple hours.
Couple hours. That's an excellent guess. That's much better than I usually get. It's actually 7.8 hours.
7.8 hours?
7.8 hours. Do the math. Look it up.
Wow.
Point is, what's the truth? So I don't poo-poo treadmills or exercise. I love it. It's important every day, but not necessarily to lose calories. Balance hormones, keep your mind sharp, keep neurotransmitters going. Absolutely. But there are an awful lot of treadmills in the United States right now with slacks hanging over them, dresses hanging over them. Well, I bought it. It just didn't do much for me.
Do you think, from an exercise standpoint, and I've had this conversation with people in the exercise business before, that sometimes people set their goals way out of range? In other words, they say, I want to look like a certain athlete or a certain model or something, when in fact the exercise should focus on health and not appearance.
You've done your research. That is the whole key of what we teach patients. That very model. That's exactly correct. It needs to focus on lifestyle. You can't tell a single mom nurse working 8, 9, 10 hours at a shift at a hospital who comes home to 2 children, homework, washing, dishes, dinner. You need to go to the gym for an hour. As we say in Brooklyn, tain't gonna happen. It's just crazy.
Right.
Now, is it worthwhile teaching her to do a 15-minute program? She can do 8 minutes in the morning, 7 at night, 7 minutes at night, and never leave her house? Of course. Does it work? Absolutely.
Right.
Can she still have Haagen-Dazs? Yes, you can have Haagen-Dazs. Why? Because it tastes good.
Yeah.
I don't mean to plug a product. It can be anything. But my point is, very simply, you can have them. You just can't have all that you want. We're going to show you how much you can.
In excess.
Yeah.
In excess. When we talk about exercise, give me some specifics on things that people can do that would be simple. Like you say, for somebody who has a career, who's, going to be working a lot, children to take care of, what can we do in the house that will make a difference? And I'm not talking about a quick fix, but over time.
Right. So simple things, very, very simple things, is knock out the leisure. What does that mean? If you've got a television in your bedroom, get rid of it. If you're finding yourself sitting at watching television just for fun, stand up next to your chair and walk in place. Body exercises, the old-time Jack LaLanne, push-ups, they're good, absolutely, and variations for those who can't do it. So there are lots of home exercises, most of which are resistance training, because unlike what we've been taught, resistance training is far more effective at losing weight, at keeping neurotransmitters intact, your thyroid, your sugars, insulin, much more effective than running on that treadmill. So I think there are lots of things that can be done that are sane and can be done in short increments as long as it's consistent and done every day.
When you say resistance training, you're talking about strength training, which
Correct.
would be push-ups or weightlifting or whatever. Explain to the audience why that is a more efficient way to lose weight than just doing a bunch of cardio.
Great. So if you're trying an appetite program, a weight loss program, whatever the crazy ones are, I would recommend you don't. You really need to have the symphony approach and all that. But put that aside. You decided to take a weight loss program, whatever it is. Your goal is to lose weight from 180 to 170. If you do that, you're happy. You've lost 10 pounds. I'm not. I'm not happy because your goal was to lose 10 pounds. If you diet, if you reduce the amount of calories you take in, your body says, I'm starving. But you still need energy. You still come into the television studio. You've got to have something. So it's got to get that energy from someplace. You don't have sugar anymore because in your appetite program, we've cut down the sugar. So where's that energy coming from? Muscle and fat. Those are the only other two places. Here's the big deal. Your body preferentially loses muscle.
Before fat.
Way before fat. Muscle is the biggest user you have of sugar. So I'm going to tie this all together. I'm eating some sugar. Where do I want it? I want my muscles to be active to use that sugar so it doesn't become a coronary artery problem or an obesity problem. I want muscle to be able to use it. So if you're on a weight loss program, you got to be doing resistance training. You just absolutely have to. You need to do it from a wellness standpoint anyway, but particularly when you're dieting. Now, I'm not poo-pooing the aerobics. You can do that, but you're working your legs and your lungs. That's fine. I need all of your muscles working to burn sugar. It's far more effective. The studies are replete. They're everywhere.
So if it's either or, if your choice is to do strength training or aerobics, strength training first.
Absolutely.
You bring something up interesting talking about your muscles using the sugar. Does that mean if you're a diabetic that it's going to be extremely helpful for you to have some sort of strength training program?
It's the key recommendation that I present to every one of my diabetic patients. Resistance training for sure. What's the big thing? It goes back to, and there'll be a lot of people saying, wow, Dr. Atkins. Well, Dr. Atkins may have been a little extreme, but his physiology, biochemistry, and science was absolutely spot on. You need to lower your carbohydrates. You mean my sugars. No, your carbohydrates. And here's the crazy stuff that is the truth. Carbohydrates mean Snickers bars? Yeah. They also mean red wine. No kidding. They also mean fruits, bananas. Well, I thought fruits were good. I'm a diabetic, lost my kidneys. If I eat watermelons, raisins, grapes, and a peach during the day, my blood sugar will be 400, normal being 99 or under. 400 the next day. Fruits aren't bad, but you have to limit the quantity as a diabetic. Starches, potatoes, white. White is wicked. Again, no bad foods, but you've got to really, really limit them.
And talking about Atkins, one of the things that he focused on was protein.
Protein, absolutely, absolutely. Diabetics.
And where should we get protein?
Well, there are lots of ways to do it now. Protein comes from the things that you know already. Cheese, fish, nuts, legumes, all of those things have proteins in them. But now you can do it in a very efficient way because, without getting into a lot of medical stuff, you want to lower your carbohydrates. You just absolutely do. You want to increase your protein. Tough to do do I eat a steak? Do I eat a... So now there are protein shakes. You have to look at them. You have to say, how many carbohydrates are in them? Some of them have 25 or 30, and you think you're doing well because you're having a protein shake. No, low carbohydrates. So we have a protein shake, for example, in our office. It's 1 gram of carbohydrates. By carbohydrates, I mean sugar. 1 gram. That's a spit. That allows me to have a banana later in the afternoon. Make sense?
Is it okay for me to eat a steak? I mean, a lot of times people say,
Absolutely.
stay away from red meat, or what? I mean,
No,
is it
it's
okay?
a protein, yeah. Now, would you eat steak 5 days a week? No, why? Because there's a fat content in there. Fat's not bad, but there are some fats that we know are deleterious to hearts. And so I watch that very carefully. But would I shun a steak or a, a pork chop? Of course not. Fish, absolutely. White meats, absolutely.
What kind of fish?
Proteins. Ones that are dead. I'm not a bait eater, unfortunately. My wife is the sushi eater.
Well, I'm talking about, like, for example, I hear a lot of good things about salmon, for example.
Salmon is very good. Salmon has a high level of those things you've been hearing about, omega-3s.
Right.
You have to watch it, though, because mercury's involved. I love salmon. It's a great, great choice. Any of the cold water fish are fine. Trout is great. I really don't know bad fish. There's none that I could sit there and say, whatever you do, don't eat cod. That's really bad.
Right.
No,
not the case at
no,
all.
sir.
I read somewhere, I think you were quoted as saying that sugar is as addictive as heroin.
That's worse.
Really?
Yeah.
Expand.
Brain receptors for sugar, very, very high. Receptors in the gut, GI tract, they crave it. They absolutely crave it. And then in addition to that, you get into for lack of a better word, people would say, oh, it's a weakness of yours. No, the craving is inherent in you. And here's why. Because as you take in sugar, Snickers bar, your insulin goes spiking up, very, very high. Insulin is an inflamer, not such a hot thing to have. We don't want it up there. We want it down here. We need it because we want the sugar to go into muscle. Remember that muscle thing?
Right.
So you want insulin, but not like that. When you divulge in some sort of a sugar product, whatever the Dickens is, insulin goes way up, blood sugar goes way up, and then that puts together a cascade of different neurotransmitters and hormones that go into play that say, I'm okay. And then it drops very rapidly. And as it drops, that same set of neurotransmitters, hormones say, you're starving. And your energy, it's a little down. Go to lunch, have some cheesecake. After lunch. So
Vicious cycle.
it's a very, very vicious cycle. And the key is, it's not the individual's fault. There's no fault here. It's a cycle of need. And that's what we teach them to change.
If I am someone who does not have a healthy lifestyle, but I say, I'm going to change, I'm going to make myself better, tell me the things that I should be doing as far as exercise and things of that nature. And I know, and one of the other things I want you to touch on is sleep and stress.
Yeah. So you've hit on all the biggies. So the first things to do in a patient who wants some sort of a wellness parameter is, obviously, it's 2011, you know, the old Back to the Future, hello McFly. It's 2011. If you're smoking, stop.
Right.
Really hard. Okay, get help. We've got help available. So alcohol. Can I have alcohol? Sure. Have a glass of wine at night. Really? Sure. It's an inflamer, but have one. I really like 3 or 4. Well, you know what? Use lighter fluid. These are inflaming agents, so you want to decrease them, okay? So smoking, alcohol, any of the abuses, if you're taking drugs, that's craziness. So let's put that aside and say, what are the wellness things that I need to do? First is commitment. You have to commit and say, this is not a 2-week plan. This is a commitment for life. I am making a lifestyle change. Hard thing to do, and we teach them how to make that commitment because it ain't easy. All right. So once you've done that, then you have to look at lifestyle parameters. What are the things we know? Low sugars, an appetite program that includes those things that you can eat on occasions and how to do it. The proper amount, meaning calories, if you will. People don't count calories in my program, but a caloric amount that fulfills your needs. An activity program. Did you say exercise? No, activity. I like to garden. Good. Gardening counts. I like to walk. Good. And to go back to my great aunt's comment, better today than I was yesterday. You with me? So there's a study, I'll do it very quickly because I know our time is short, but diabetics were put on 10,000 steps a day in Japan. And a majority of those diabetics went off insulin, went off their diabetic medications, lost weight, did wonderfully well by doing 10,000 steps a day and low sugar. All right, they put that together. Here we go. Wonderful. 10,000 steps, that's 4.5 miles of walking a day. It's a lot of walking. So what do I tell my patients? 250 steps. Here's a pedometer. 500 steps. I'm an athlete, doc. Good. You get 5,000. Go to 5,100 the next day. Baby steps to wellness.
And there's little things you can do, like when you pull up into the parking lot of the department store, you don't have to park to the closest one, right?
Yeah. I race my daughter when we go to the airport. I have to run up the stairs with the luggage, and she takes the elevator and mocks me.
One of the things that I read that in some of your material that I thought was extremely interesting, and we are short on time, but in about 2 minutes or so, tell me about, and this is a mental thing, and this is an emotional thing, but you said giving and positive attitude.
Yeah.
Expand.
So, okay, in the nuts and briefy, forgive my New York speed or New England speed. Patients often come to me and what they're looking for is, bottom line, how do I get happy? And I don't have a pill, a shot for that. So they say, how do you stay happy? And I say, here's what I do. I walk from my bedroom to my daughter's bedroom every day, but I stop midway and I look out in my backyard. And what I basically do is I say a mnemonic for me. And the mnemonic really has to do with G, giving. That's very, very important. A, accepting. Hard thing to do. Accept what's going to happen. Oil spills, whatever. A year from now, you're not going to remember it. Learn to accept what is happening today. I think there's a tremendous other A, and that's appreciation. So I always stop and say, I need to appreciate that breath, because I was in a situation where a machine was breathing for me. I don't ever, ever forget how it is to breathe. Very, very, very important. Giving to others. Yes, your wife, yes, your kids, but how about the gal at the checkout counter? You look great today, Grace. What do you think that does for her? Phenomenal. But what does it do for you? You get to walk away and go, I done good.
That's right. Your website is?
FloridaHealthspan.com. www.floridahealthspan.com.
Okay.
And
some blogs on there that people will find interesting?
Lots of blogs, lots of fun. We're in the process of doing about 50 more, so that we'll have topics like hormones and vitamins and what do they do and which ones work and which ones don't.
Dr. Schneider, it was a real pleasure.
Oh, it's entirely mine, Jeff. Thank you.
I think we learned a lot.
Good, good, good.
We'll have to have you back again. I mean, we could go on for a couple hours with this. We thank all of you so very much for watching this edition of Conversations. By the way, you can find us on Facebook. All you have to do is search out Conversations with Jeff Weeks. And if you'd like to see some of our past episodes, you can do so. We're online, WSRE.org/conversations. I hope you enjoyed this broadcast. I'm Jeff Weeks. Take very good care of yourself, just like Dr. Schneider said. And we'll see you soon.
Support for this program is provided in part by these corporate sponsors. And by viewers like you.